redouble efforts to create more awareness to end tuberculosis in the country. Speaking at the activity lineup to commemorate the World TB Day in Abuja, they say with the theme of this year's celebration, the clock is ticking, global leaders must come together to scale up access to prevention, treatment, and finance for research. Experts also say despite progress being made over the years to end tuberculosis, it still remains the worst infectious disease killer globally. They, however, urge countries to hold up to their high-level commitment to end TB in 2022 or risk losing thousands to the disease annually.
Tuberculosis (TB) is an infectious disease caused by the Mycobacterium tuberculosis bacteria. This disease primarily affects the lungs but can also attack other parts of the body such as the kidneys, spine, and brain. TB spreads through the air when an infected person coughs, sneezes, or talks, allowing the bacteria to be inhaled by others. Symptoms of tuberculosis. TB symptoms can vary, especially depending on the part of the body affected. However, for pulmonary TB, common symptoms include 1. Persistent cough with phlegm or blood for more than 2 weeks. 2. Fever without an obvious cause, usually at night. 3. Excessive night sweats. 4. Unexplained weight loss. 5. Weakness and fatigue. 6. Loss of appetite. 7. Chest pain, especially when breathing or coughing. Diagnosis of TB. To diagnose TB, several tests can be performed, including 1. Sputum test, to detect TB bacteria in the sputum sample. 2. Chest X-ray, to check for lung damage. 3. Mantoux test PPD, a small injection under the skin to check for a reaction to TB. 4. Blood tests. Special blood tests can identify latent TB infection. Treatment of TB. TB can be treated with antibiotics, but treatment must last for a long period, 6–12 months, because TB bacteria multiply slowly. Some commonly used drugs in TB treatment are 1. Isoniazid INH. 2. Rifampin RIF. 3. Ethambutol EMB. 4. Pyrazinamide PZA. TB patients must strictly follow the prescribed treatment until completion to avoid drug resistance (MDR-TB) or multidrug-resistant TB, where the bacteria become resistant to certain antibiotics. TB prevention. 1. BCG vaccination, Bacillus calmette-guerin, can be given to infants to protect against severe TB, especially TB meningitis. 2. Avoid contact with active TB patients, especially in enclosed, poorly ventilated spaces. 3. Use masks for TB patients to prevent transmission. 4. Improve ventilation and maintain a clean environment. Latent TB versus active TB. Latent TB. TB bacteria are present in the body but inactive. People with latent TB are not contagious and show no symptoms, but it can develop into active TB if left untreated. Active TB. TB bacteria are active and cause symptoms. People with active TB are contagious to others. Proper treatment and prevention are essential to controlling the spread of TB.